Hello and welcome. Thank you for being here with us. We're just going to give everyone a couple of minutes to join and then we will kick off shortly. For those who are newly joining us, we're just going to give everyone a couple minutes to join and then we will kick off in a minute or so. Yes. While we are waiting and giving everyone a couple of moments to log on, I would love to hear what TV shows everyone has been watching and loving lately. You can feel free to drop your favorites into the chat. I am personally watching 4 to 5 seasons of Slow Horses on Apple TV, which is a fun, um, comedic yet thrilling British spy show. I would love to hear what everyone else is watching. Oh, Wednesday is a good one. That's a favorite.
I personally am rewatching Stranger Things because the last season comes out like the end of this month and next month, and I have forgotten every single thing that has happened in that show. So I'm almost done with the most recent season.
Absolutely. Oh, the new Claire Danes show. I was a big fan of Homeland, so I'm excited to watch that one. And for those that are just joining, I promise this is not a webinar about TV shows. We're just giving everyone a couple minutes to join and then we will get started. But we were asking what TV shows people are watching and loving lately.
I have a couple young kids at home. I don't watch too much TV, but when I do, I need something like very easy watching. So I'm very into competition shows. Just caught up on the newest season of Great British Bake Off.
Oh, yes.
Just watched this past week Building the Band, which is like a, singing competition show. It was good. It fits the I need something that is not I can start and stop and not be too invested or fall asleep to, and that is just fine.
I love it. I love it. All right. Well, we've hit the 2 minute mark. And I'm so excited to see the turnout that we're having across the country. Thank you so much, everyone, for joining. We know how important this topic has become for HR and benefits leaders, and we're absolutely thrilled that you'll be spending the next hour with us. I do think we've got a pretty good group size now, so I'm going to go ahead and kick things off. A quick housekeeping note before we dive in. We'll have some time for questions at the end, so please drop any questions that you have into the Q&A at the bottom of your Zoom screen. We'll do our best to answer all of those questions at the end of the session. The session is also being recorded, and you'll receive a recording after the event. And I just want to thank you for joining us today for a deep dive into an area of support that has really been top of mind for many of us, which is fertility care. We're hoping that you come away from this conversation prepared and inspired to lead change at your organization. And before we begin, I just want to take a moment to introduce myself and the incredible speakers that have joined us on our call today. I am Caitlin Ardrey. I'm Senior Director of Fertility Program Strategy here at Maven. In my role, I work closely with employers to design programs that deliver better outcomes for employees and real ROI for benefits teams as well. I'm joined today by two incredible guests from ServiceTitan. First, we have Leanna Lilly, who leads benefits and mobility at ServiceTitan, and then Sophia Icavelli, Manager of FinTech Utilization at ServiceTitan and a Maven member. She'll share her personal experience navigating fertility and maternity care through Maven. Leanna, would you like to start by introducing yourself and sharing a bit about your background?
Sure. Today is actually my 6-year anniversary at ServiceTitan, so I'm happy to be here celebrating that with all of you. I started at ServiceTitan 6 years ago. At the time, we were about 800 employees. We had never had a benefits person before. Our BP team was owning benefits. And so I came in, kind of have built the program from scratch. Now we're over 3,000 employees worldwide. Very excited to be joining today. been here 6 years, and we actually rolled out our first iteration, like our first offering of Maven about 6 months after I started. So about 5.5 years ago.
Awesome. Sophia, how about you? Tell us a bit about your role at ServiceTitan and what inspired you to join us today.
Yeah, thank you so much. So my name is Sophia, and I have been with ServiceTitan for 7 years, which makes me like one of the oldies over here. And I was really inspired to talk about Maven today as someone who used it just to like the full extent that one could use Maven. And I just really wanted to share my experience because it was so integral to my pregnancy journey and postpartum journey. And I just wanted to share that all with you guys today.
Awesome. Thank you so much. I'd like it to take first a quick minute to introduce Maven for those who may not yet be familiar with us. Maven is the world's largest virtual clinic for women and families, trusted by more than 2,000 employers and health plans across 175 countries, reaching over 23 million covered lives. And our mission is simple: to make healthcare work for all of us. What sets Maven apart is that our care model is evidence-based and outcomes-driven. We provide clinical, emotional, and financial support in one place through our always-on platform that is available 24/7, 365 days a year across the globe to support members when and where they need it. We offer compassionate care at some of the most joyful and vulnerable life stages, including fertility and family building, maternity and newborn care, parenting and pediatrics, and menopause and ongoing care. We're focused on connecting our members to comprehensive women's and family health care at every step of their journey and addressing existing gaps and disparities in our traditional healthcare system. Employers that partner with Maven have seen an average of $9,600 in savings per birth, a 27% lower NICU rate, and a 15% reduction in C-section rates. These aren't abstract metrics. They reflect healthier parents, healthier babies, and more efficient healthcare spending. And we're proud to work with some of the most forward-thinking organizations in the world who are redefining what inclusive, data-driven family benefits look like. So that's the lens we're bringing to today's conversation: how integrated fertility and maternity care can create better outcomes for employees and measurable values for employers as well. Before I jump into questions with our panel, I want to start by framing the moment that we're in today. With the new guidance from the White House, fertility care is really in the national spotlight, and it's creating new considerations for employers. Back in February of 2025, the White House issued an executive order called Expanding Access to In Vitro Fertilization. With this executive order, the administration indicated that they value making it easier for families to battle infertility and have children. One way that they want to do that is by making IVF more accessible, both financially and logistically. In October of 2025, very recently, the White House issued new guidance outlining what that vision could look like in practice. The headline is affordability and flexibility. Medication costs are expected to drop, and the pharmacy benefit managers have also committed to honoring this principle, this pricing as well, which could eventually lower costs for employers that are offering managed fertility benefits. Federal agencies are exploring the idea of more flexible, carved out fertility benefits, similar to how dental and vision benefits work today. And if that model moves forward, employers could soon offer fertility coverage that's more inclusive, customizable, easier to administer alongside their existing medical plans, which is exciting as well. And for HR and benefit leaders, this is about more than compliance. It's about rethinking how fertility and maternity benefits work together to deliver better care, reduce costs, and improve outcomes for employees. Forward-thinking organizations can turn this moment into a competitive advantage. By integrating clinically managed fertility support with comprehensive maternity care, organizations can see stronger outcomes for parents and babies, fewer complications, measurable cost savings, up to $9,600 per birth. And today we're going to explore how that's possible. You'll hear directly from Leanna, about how ServiceTitan built a connected family benefit strategy, and from Sophia as well on what that looked like in practice as a ServiceTitan employee and Maven member. So now to start off the conversation, I would love to hear from all of you around what best describes your current family building benefits program. So we'll give everyone a moment here to answer our poll question. Got a couple different options here, so we'll just give everyone a moment to provide their response, and then we'll talk about the results. All right, so the poll has closed, and we've definitely got people attending this webinar who are really in different stages of their family building benefits programs. We've got a good number of attendees that do not have fertility and maternity benefits being offered today. Perhaps are considering adding those for the first time. We've got a small portion of folks who are already offering a standalone fertility or maternity benefit from a benefits vendor, and then as well some folks that are offering these benefits either completely or partially integrated to their health plan coverage. So a good mix, but some really strong attendance here, and a starting point for some different folks that don't have fertility and maternity benefits being offered today. So really excited to speak more about these topics for that audience, as well as for those that have those benefits either partially or completely through their health plan, and where there might be opportunities for enhancement there as well. So a good mix of results there. So given what we know about the recent updates to federal guidance on family building benefits, it's important that we consider how that impacts all of you, the benefits leaders tasked with building benefits programs that support both your employees and your company. For many organizations, fertility and maternity care are among the top drivers of healthcare spend, but they're also among the most valued benefits by your employees. The challenge is that traditional programs often work in silos. Fertility care stops at conception, and then maternity care starts later in the journey. And without coordination, employers end up with rising costs, and employees face fragmented care. But when these benefits are connected, when there's clinical oversight from the first fertility consultation through postpartum, you can prevent unnecessary treatments, reduce complications, and give employees a far better experience. And so, Leanna, I would actually love to hear your perspective on this. You've been at ServiceTitan for about 6 years and spent many years prior in the benefits and wellness space, including consulting on benefits program development and management. And I'd love to know, how have you seen employers' approaches to fertility and maternity benefits evolving over time?
Yeah, I've seen a lot of evolution over, say, maybe the last 10 or 15 years, just in how people are thinking about this. Is this something that's like a really special perk that's only offered by some tech companies, things like that? But even, I'm going to share a little bit of my story at ServiceTitan and how our evolution has, over these 6 years, has even changed just in how we were incrementally able to get there. So I said we started partnering with Maven it was very early 2020. And at the time, we only had the maternity program. So supporting families through pregnancy, so from conception onward. And we had that for a couple years. We knew we wanted to show support and kind of build a culture of showing up for parents. It was a very strategic move that we were trying to recruit this middle-aged, kind of mid-career person. So for about 2 years, that's all we had. I knew I wanted to get fertility in place, but I didn't have a budget. I saw somebody ask a question like, where does the budget come from? So where I started was I added it as an add-on to one of our medical plans. So first starting that medical plan route, adding a premium medical plan option that had fertility coverage so that if an employee wanted it, they could choose that increased premium. I had that in place for a year. And then we went to renewal. We had some competition. We had a new company kind of bidding for our business, and they actually offered to then take and roll out those fertility benefits to every single medical plan at no additional cost. So that was really lucky on our part, but we had started the journey of like getting it into the medical plan. We got it extended to all of the medical plans. And then when we went self-insured, it was already something was in our medical plan. We weren't going to remove it at that point. But when we moved self-insured, we decided we wanted to carve it out. We said, hey, let's take these costs. We're going to be paying for them anyway. They're already in the medical plan. And that is when we carved our fertility benefit out into Maven. So we could have expanded coverage for single moms who wanted to become parents, for same-sex couples, that it was a much more comprehensive benefit that would be available to everyone without having to have a diagnosis of infertility. So that's really how we got to offering fertility coverage. It wasn't until 2025 when we actually carved out with Maven. So almost, from 2020 to 2025 was kind of our stair-step journey to get there. So even just like a company like ours who values this, we are a tech company, it took me incrementally moving in that direction to get where we are today. It's not just, I went to my leaders and said, hey, give me the money.
Yeah, and Leanna, that makes a lot of sense in terms of kind of making that incremental progress as you kind of continue to expand and make those comprehensive benefits more equitable, more inclusive, more accessible to employees. And as a result, at ServiceTitan, you've been able to create a really comprehensive benefits program. And I'm curious, I think you started to touch on this, but could you share with the group why fertility benefits were so important for your broader program and your benefit strategy?
Yeah, when I started, we were kind of at an inflection point where we really were trying to grow as a company and to hire kind of more experienced people. We wanted to hire those people who were mid-career. So we put in place a very strategic benefits package of we're recruiting where we're competing with really other companies that have really great benefits packages. And so how do we create this, like what's important to us and what's important to our co-founders and who's the person we're looking to recruit for? So that's how we built our package. We said this very intentional. We want mid-level employees that want to work at a great company where they feel really well supported and they want to build families, that they're willing to kind of uproot themselves. And so we put in a couple different benefits that kind of were creating that structure, that like we're telling a story with our benefits package. And let me tell you, when I work with our insurance carriers to look at our data of medical utilization, it has worked. In our last annual report, our delivery volume, so like our babies being born, is nearly double that of our high-tech peers. So peers in our same group, we have twice as many births in a year as they do, but our costs aren't completely out of control because I think we've put these things in place to support people. Like Sophia's going to talk about, like support from trying to get pregnant kind of throughout that fertility process, from the time that people are already familiar with this benefit from very early on in their pregnancy journey, they have this ongoing support and they have it for 1 year postpartum. So this has helped us kind of have double our maternity numbers, but also to make sure that those costs aren't completely astronomical and out of control, because we've been able to do it in such a way that we can catch things early for people, that they have someone to talk to. If something is weird, they can talk with someone. But I kind of use it as a flag for people of like, what we did in 2020 is working, because this is a place where people want to have kids, and we're having to, kind of deal with some of that on the back end of like lots of leave volume, lots of
course, yeah.
But we love it. And we have a lot of long tenure of our employees. And I've actually had many employees tell me like, I haven't had kids yet, but I'm not going anywhere until I do, because this is where I want to be to build a family. That's what I'm aiming for.
That's so wonderful to hear. And I would imagine that being able to pair that increase in pregnancies and being born with kind of not necessarily seeing that commensurate increase in costs is really critical when you are trying to gain executive or cross-functional buy-in for adding new benefits such as these into your suite of benefits. I'm curious how you frame these conversations internally with your leadership and with your finance team, whether it be back in 2020 or when you were making that decision even to carve out the fertility benefits to Maven in 25. What really works from your standpoint in terms of gaining that cross-functional and executive leadership buy-in?
I think my incremental approach made it much easier. So I think that is one of them, of like, asking for the moon is not what a CFO wants to hear, of like what the, what that end goal is. It's that incrementally getting there. But I think also being really clear on the why for the company. And for us, this isn't a feel good offering just because it's like, oh, that'd be a nice to have. For us, these programs can be like, have been really beneficial for the bottom line of like helping us in our recruitment and helping us to be able to retain some of these people. And so for me, it's been telling that story and like painting the picture of like what we're trying to accomplish long term, who we're trying to recruit, who we're trying to hire, and like that long term, like, what are we trying to build here and who are we trying to build it for? So I like to think of myself as I'm a storyteller, and that's how I show up to my leaders, and I get to tell the story, and I need to frame it for how that stakeholder needs to hear it. So for my CFO, I'm going to talk about some of the cost. Like, we've got to contain these costs. If we are having people who are giving birth, we've got to make sure we're catching, we're getting the treatment they need early. We're kind of getting ahead of some of these things. If I'm talking to my chief people officer, the story I'm telling is who we're trying to recruit, who we're trying to retain, like this big picture of like who we want to be and how we want to position ourselves. And so I think it's figuring that story and then being able to effectively tell it. I think that's kind of our role as a benefits professional, is like being able to like get people to come along on that journey with us.
Yeah, absolutely. And it sounds like the key messages may differ, right, for the different audiences that you need to engage to get that buy-in cross-functionally and from an executive standpoint. And we're speaking specifically to that audience, the finance team, the CFO at your company. The financial aspect and kind of getting buy-in for any incremental budget needs, right? Even if that is incremental over time, that can be a challenge. And I think we at Maven are constantly hearing that, fertility costs are rising on both sides of the equation for both employees and for employers. Over 70% of employers say that the cost of fertility care has increased for their organization, while nearly a third of employees seeking fertility treatments have taken on debt to cover that treatment. And so for employers in particular, I think there can be a lot of hidden costs with a traditional fertility benefit. And I wanted to share what a few of those are. Number one is over-reliance on IVF as the primary intervention when there are fertility risk indicators or a potential infertility issue. On average, women will go through 3 to 4 failed IUI cycles, 6 rounds of IVF before successfully conceiving. Some of those numbers are staggering. And at over $23,000 a cycle, you can see how these costs add up quickly for employees and their companies if the majority of people who, think they need fertility treatments to build their families are going, right into things like IUI and IVF. Unfortunately, there's also the medication inflation. Fertility drug costs have increased 84% over the past decade, and employers often don't realize how much of their claims spend comes from rising pharmacy costs that are tied to these unmanaged cycles. And then later down the line, that connectivity between fertility and maternity care, there can also be costs that are driven by high-risk pregnancies. So when there's multiple embryos being transferred, those unmanaged IVF cycles, the likelihood of multiples, and then down the line, the NICU admissions, increasing, which are among the most expensive cost drivers in maternity care, with that average NICU stay costing over $60,000 a week. So I think that's why programs that take a modern, proactive, and comprehensive approach really do matter. They can catch risks early, be really proactive, right, with guiding employees appropriately to help them build their families, and then cut costs before they're even incurred down the line. And so, Leanna, I'm curious about how these cost savings conversations may have come up at ServiceTitan as you were considering expanding. or even, back in the day began implementing these fertility and maternity benefits. Are there particular metrics or feedback that helped you to validate the success of ServiceTitan's approach in those earlier stages or in the ongoing administration of the program?
Yeah, so one of the things that we put in place to kind of cap our risk is we have a dollar amount cap limit. So it's a lifetime limit of $20,000 reimbursement. So our current program is outside of the medical plan. So it used to be there was a cap within the medical plan, and now it's a cap kind of outside through Maven with a lifetime limit. So that kind of limits the amount of risk that the company is taking on to be able to support people through these. I think as I have progressed, we've been continuing to add and change how our program is evolving and functioning. I think I've also had to change my thinking a little bit. I used to carve some of these things out and provide detailed information to senior leadership about each of these specific things of here's how costs are looking within, kind of different conditions and different things. But I think over time, one of the things that I've changed my thinking about is packaging it together of we think about fertility care and maternity care as healthcare. And so I don't necessarily go through the efficacy of every single mental health, program that we have in place or like within the medical plan of the different types of care. And so I think I've had to be careful over time to not necessarily segment things out of like, this is like, let's deep dive into this. If we've decided that offering this type of medical care is a place that we want to show up, and this is medical care we want to offer, I want to report back to our senior leadership of like how our medical plan is doing. How is our cost? How are we being intentional about the cost that we are spending in certain areas, but more of like, how are we trying to contain those costs? And like, so I'm trying not to like pull things out, but like put them in the bucket of like how we're thinking about medical spend. Because I think if we pull it out and say, here is what fertility looks like, in some ways, once we start kind of completely segregating it from all the rest of medical care, we stop thinking about it as like we are managing our medical spend and our medical program, and they think about it different. So I've been more intentional even about talking when I'm talking about for renewal, putting in front of them, this is what our anticipated medical spend is going to look like next year. I've started putting Maven Maternity in that cost when I used to talk about it as a perk. I don't think about it as a perk anymore because it's not a perk. It is part of our medical spend of offering, maternity care for our employees. And I bucket it now into our overall medical spend when I'm talking about those high numbers of what we think our costs are going to be. So I think it's even just like framing it in terms of like those types of conversations when we're talking about medical care.
Makes complete sense. Really appreciate you sharing that. Leanna just described for us the strategy and structure behind ServiceTitan's approach and how she's navigated gaining buy-in and proving value. But we also want to talk about what that looks like for an employee who is actually going through this journey. And we know that behind every data point, there is a deeply personal story, a family, a set of decisions, a moment when support really makes that difference. And that is why I'm so grateful that Sophia is also with us today. She's experienced ServiceTitan's integrated program firsthand through Maven. And I think her story really brings to life what this kind of care can mean in practice as well. So, Sophia, thank you again for being here and for your openness to sharing your story. You went through your family building journey with Maven as part of ServiceTitan's integrated benefit. And so I'd first love if you could, we just would love to hear your perspective on how these benefits have made an impact for you personally, telling us a little bit more about your journey, what it looked like before Maven, how did the experience change once you had the support during your pregnancy?
Yeah, absolutely. So my pregnancy and birth story is actually a little dramatic, and was saved almost single-handedly by the support that I had from Maven. So I was one of those exceedingly smart people who decided that having a baby during a pandemic was a good move. I was at home and we had nothing else going on. So we're like, well, now seems like the great time to start a family. But that came with so many issues that I was just not prepared to handle. The first being like right after my 2-month appointment with my OB, she looked me dead into my eyes and said, "Hey, I'm actually no longer doing births. I've decided this year I'm retiring, so I will not be able to birth your child." And so as someone who is struggling with moving my work remote, becoming pregnant for the first time during a worldwide pandemic, and being just canceled by my OB, I had no idea where to start. And I started with Maven. I literally chat my coordinator, and I was like, "Hi, I have just run into the most awful thing you could possibly imagine. What do I do?" And she said, "Give me a list of your insurance, where you are, what range you want someone in, and like what kinds of doctors are you looking for." And so I knew I specifically wanted someone who was within 20-minute drive. I wanted a female doctor. Here was my insurance. The next day, I got a list of like 15 OBs that were taking new patients. And I called down the list, found the one that I clicked with, and I went and saw her like the next day. And that could not have happened without Maven. Like the stress of all of that, and also being within my first trimester with a high-risk pregnancy, and being able to get that list of doctors immediately without me having to do my own legwork, taking time out of work to actually like go and try to figure out who these doctors were, I think about it a lot, honestly, how much that helped change my life. And then even through the journey, I was high risk. I had postpartum preeclampsia, which is another story that Maven helped with later down the line, but they helped me find places that did high risk scans, because the doctor was having trouble finding some place that was open to do high risk scans during the pandemic, and they helped me find a place to do high risk scans. I did so many classes through Maven. I did birth planning, breastfeeding 101, infant CPR, like literally any class that Maven had available, I was signing up for it. But the one that really, really got me was there was a webinar about getting the COVID vaccine while you were pregnant. Obviously, that was like top of mind for me. I didn't know if it was safe. I didn't know if it was something that I should be making the choice to get. And Maven had a webinar and said, "Join this webinar and find out more information from trusted experts." And I did, and it helped make the decision to get the COVID vaccine while I was pregnant. So it just all around, without Maven, my pregnancy experience would have been so much different, especially towards the end when my son ended up being born by emergency C-section a month early because of my blood pressure. And I actually ended up getting postpartum preeclampsia. And when I got home, they sent me home from the hospital before I had developed preeclampsia. And the first person I thought when I knew things weren't right was to chat my coordinator. And they're like, "You need to go back to the doctor, like immediately. Get into your car, drive over, call your OB, because something isn't right." And I honestly, that saved my life. I was like 180 over 120 with my blood pressure, and I was like on the verge of having seizures, and they told me to go to the doctor, and I did. And I knew that they would be available for me 24/7. I knew someone would answer if I had a question. And it made all the difference in the world, for sure.
I so appreciate you sharing that, and how Maven supported you at different phases of your pregnancy and then postpartum as well. That's really scary, and I'm glad your care advocate was there to support you. I guess, what stands out to you most when you think about the difference that having this type of support offered by your employer has made?
Well, one, I mean, loyalty to this company for sure. I knew that my son would be my first and last baby. And I took full advantage of Maven, but the fact that it was available, like, I think about that all the time. Like, without ServiceTitan offering me Maven, my pregnancy journey, my birth journey could have ended very differently. And I was excited to come back to work. I was excited to come back and like be a part of this company that cared so much about me and my journey as someone who was pregnant, because pregnancy takes you out of work, right? I gave birth and I was out of work for an extended period of time. And as someone who works at a company, you'd think like, oh, you don't really want to encourage that. because then you have all these employees who are gone. And actually, in my department, there's 9 people who are currently pregnant or going to have babies like very soon. And it just like, I knew that a company that cared enough to offer me something that would take me out of the company for a certain amount of time was worth going back to. And then having the opportunity to do things like food allergy classes and sleep classes and lactation classes really helped me like prepare and plan for when I was going back into the office.
Well, you're mentioning return to work and kind of going back. I'm curious, did the support that you were offered through Maven help to prepare you for returning to work? It sounds like there are definitely some things with, with different classes that were very helpful, but would love to hear a little bit more about that.
Yeah, it was something that I reached out to my care coordinator as I got closer to the time that I needed to go back about like, how do I plan? And she offered me a lot of like insights into things that I can do to like, I was pumping at the time. So how to like store my stash appropriately and how to make sure that my child is sleeping through the night and getting through, getting in naps. And I was even looking into nannies, and they helped provide a list of companies that I could get nanny services through. So anything that I needed to help prepare myself and my child for this transition, she was right there to offer me guidance and assistance in anything that I needed to come back in a way that I was actually excited to come back to work. I know a lot of people talk about like that part of your life where you like have to separate from this little tiny newborn baby. And I felt way more prepared than if I had to have searched all that information for myself.
Absolutely. Sophia, thank you. Your story really shows, I think, what's possible when care is accessible, proactive, clinically validated, and emotionally supportive. And that individual experience, I think, adds up to measurable results for employers and families alike. So we'd love to look at what those outcomes actually do look like in practice. And so we've got some great stats here, I think, for ServiceTitan. Leanna, I'm curious how these outcomes really shown up for you at ServiceTitan.
Well, I talked about our maternity cases. People are having babies. But I actually think one of the things that is so interesting to me is I also lead our leaves program, and we're very intentional about sharing information with employees going out on leaves, making sure they are enrolled in Maven. And it's interesting, we do all of our marketing on that side, but more often than not, our employees who are going out on leave have already signed up for Maven, already know about Maven because they heard it from one of their peers. People like Sophia, when she has colleagues who find out they're pregnant, they are sharing this with each other. So I think that energy and that excitement and that support, I feel like that's been one of the outcomes where people are like, oh, I must tell our women's channel all the time when people are announcing like, hey, what things do I need to know? Everybody's like, you need to go sign up for Maven. You need this support. Like you need this. And so I think for me, that's exciting where there's this energy and this people sharing with each other because they care about their colleagues and want to make sure they have the same level of support. So I think for me, like that has been so impactful that these people that are showing up here, having these sessions, a lot of times they're getting referred by their colleagues.
Absolutely. Absolutely. Word of mouth is incredibly powerful. And we do love different ERG groups and, different dedicated Slack channels for women and families. So those are all great opportunities to get the word out, get people engaged. And the earlier that they're engaged proactively with Maven, the more that we can drive those cost savings and those outcomes for our members and for our clients as well. So at Maven, we see that when employers provide comprehensive fertility and maternity benefits, the results are clear. There are better outcomes for families and meaningful savings for employers. So overall, our members see up to a 27% lower NICU admission rate. 30% of our fertility members are achieving pregnancy without treatment. 70% of our maternity members are more productive. And 96% of our family building members indicate that they are more loyal to their employer as a result of having these benefits accessible to them. And these outcomes, including stories like Sophia's, really make it clear how important it is to not only deliver family building and maternity support, but to make sure that it's comprehensive, easily accessible, and supportive in every moment. In every moment. Um, so before we wrap up and kind of go to audience Q&A, Leanna, I'd love to have you share, what advice you might give to HR leaders that are thinking about expanding fertility support, but are maybe unsure where to start.
I think my advice would be to think outside of the benefit space. So I think you really need to understand, who are you hiring? What's your recruitment strategy? What are you hearing from recruiters and your BPs? Like, what are HR BPs seeing and hearing from employees? What are recruiters hearing from candidates? Where are you losing candidates? What are your, like at ServiceTitan, we have ERGs. So do you have ERGs or affinity groups, or are there other populations where you can have their voices heard that might have, a way to kind of get other stakeholders and other voices involved that can kind of help build up the momentum to kind of push you over the edge? It's like trying to tell that full picture story, which is, I think, can be so much more effective than just going and asking for money. Like, I need more money, but like being able to tell the full picture of like what we're trying to accomplish, how this benefits different segments of the organization, different departments' goals. Like, how can we kind of fill the needs of as many people as possible through a benefits program?
Absolutely. And thank you. And Sophia, is there anything else that you'd like to share with HR leaders who are considering benefits like these?
I will say that ServiceTitan is a great company to work for in general, but how much time and effort and product they provide to me as an employee for my life outside of ServiceTitan, I want to work here. I want to come back. I've been at ServiceTitan 4 years postpartum, and I know that like statistically that doesn't happen very often. And I am proud to work here, and Maven is one of those things that just, I will tell everyone, you're pregnant, you're thinking about getting pregnant, Maven. And it just makes ServiceTitan what it is, and I'm very grateful to both work here and have had access to Maven.
Awesome. Well, thank you so much, Leanna and Sophia. I could keep chatting with you all day, but we are reaching the end of our time together, and I do want to leave a little bit of time here for audience questions. So I'd like to look at some of the questions that have come into the chat. And while we are chatting through questions, we're going to also launch a quick poll on the screen asking attendees for their feedback on the event today. So please take a moment to share your thoughts, and then also stick around for the Q&A portion of the webinar. So I'm gonna pop open the Q&A. Do you have, so the first question here is, do you have benefit strategies for families, for family building for AMAB folks, which I believe is assigned male at birth, who are single, or for couples where both partners are AMAB? How do we build families without a uterus and make the benefit accessible for all? So first I will say, what a great question. There are so many different family types that are on their own pathway to parenthood, whether that be opposite sex, same sex couples, single aspiring parents. And I think it's really important, at least at Maven, we think about really the importance of providing inclusive and equitable family building benefits. And that can include both the virtual care and support for all different family types through a service like Maven, but also as well in the financial benefits that are being provided for family building to support all of these different pathways to parenthood. So at Maven, we think about, family building benefits, not just as fertility benefits, but also how are we supporting individuals and couples who may need adoption support, or who may be undergoing a surrogacy journey where they'll be using a gestational carrier to build their families. And so there's an opportunity through Maven to provide the clinical and emotional support for all these different pathways to parenthood. And so to the pregnancy and postpartum journeys for these different family types, including for someone like a gestational carrier, as well as the financial benefits. But Leanna, would also welcome your thoughts on how you've kind of thought about perhaps inclusivity in your benefit strategy for all different individuals and family types?
It's a great question. And we've been very intentional about this as well. When we rolled out our maternity program in 2020, we also rolled out a $20,000 stipend or reimbursement for adoption. So if pregnancy wasn't in the cards for you and adoption was the route, so we've had that program in place since 2020. And this is one of those places where you can show up for people. You have to have it available and have it there so when someone needs it, they can take advantage of it. But these are going to be very low utilization programs. And I think it's understanding that and be able to make the case of like, we can be inclusive without it having a high cost. Since 2020, we have spent $10,000, the end, on adoption. We have it available. If someone needs it, it's not going to be as well, as not that many people as adoption their route, but if they need it, they can take advantage of it. So we've had adoption reimbursement and support since 2020, almost no cost to us. When we rolled out Carved Out with Maven, we actually added in surrogacy. We're almost a year in, and we've had no cost utilization. This may be one surrogacy case every 5 years. It's not something that many people need. And so I think it's one of those amazing places where you can offer inclusivity. It's there and ready, waiting when you have the individual that it's the right time for them, that they want to use it. And it says so much about how you're showing up for people. But I think it's a place where we can make the case to our senior leaders of like, this isn't going to be very costly for us. We may have a case every few years, but for that person and that family, it is changing their lives. Absolutely changing their lives and showing the people that you want to work for you that you care about them. We care about you and we have something there to support you and catch you if that's the kind of support you need. But again, it's $10,000 over 5 years is like music to the ears of senior leaders because it's not going to be a really costly program, but it speaks absolute volumes to the people that you're trying to hire, recruit, retain of like who you are and how you want to show up for people.
Absolutely. Couldn't agree more. And thank you for calling attention as well to their kind of different utilization patterns, right? Among these different benefits, you'll see potentially a lot more folks utilizing a fertility benefit than adoption and surrogacy, but it really is an important signal for that kind of inclusivity across pathways to parenthood. So really appreciate you calling that out. The next question in the Q&A box is there a comprehensive analysis that Maven provides specific to ROI on the 3 primary phases of family care? And I will go ahead and answer this one since it's directed to Maven. The answer is yes, absolutely. We've spoken a lot about how Maven integrates, provides really an end-to-end platform and solution for family building support. And from a fertility and a maternity ROI standpoint, we're really kind of the ROI analyses that we can and do provide really tie together those end-to-end outcomes from fertility all the way through maternity so that our clients can really understand what the full impact of an integrated benefit looks like. And in terms of return on investment, we really think of that in terms of like 2 major buckets in terms of how we are helping to improve costs, improve outcomes and reduce costs, excuse me. One is on the clinical outcomes piece of things, everything from driving, more members being able to avoid fertility treatments in the first place through comprehensive preconception and trying to conceive support to interventions in the fertility benefit like single embryo transfers, et cetera. And then in the ongoing support for maternity and postpartum, reducing C-section, NICU, even ED visit admissions. So really there is the clinical aspect in terms of ROI and quantifying the savings there. But then also another really important aspect of ROI is the kind of business productivity and loyalty side of things in terms of aligning for employers to be able to attract and retain top talent, help folks return to work and be productive as well. And so across that kind of end-to-end ROI story, we really do think about ROI in terms of those 2 main buckets, clinical and then business and productivity savings as well. All right, so it looks like those are the 2 main questions in the chat. And at this point, I think we've had a wide ranging discussion. And that's, I think, all of the questions that we had time for anyways, as we're wrapping up here. So if you'd like to learn more about the findings we talked about today, you can download the full report through the QR code that we have available. And if you have additional questions or want to connect with a member of the Maven team, please do send us a message on our contact page, which is mavenclinic.com/contact. I want to thank you all so much for your participation, the amazing questions that came in today. We're really happy that you joined us. And I also just want to say a huge, huge thank you to Leanna and Sophia for joining us, sharing your incredible insights, your stories. It really helps to bring things to life. So thank you again. And I hope everyone has a great rest of their day.
Thank you.